This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Diron 500 injection is an injectable treatment for iron deficiency anemia. It is effective and essential for those unable to take oral iron supplements. Indications and uses. This injection is indicated for the management of iron deficiency anemia in adults and adolescents over 14 years of age who can't tolerate oral iron supplements, require a rapid increase in body iron levels, or have chronic kidney disease that does not require dialysis. It is crucial for restoring iron levels in patients lacking sufficient iron, which is vital for producing red blood cells and transporting oxygen throughout the body. Testing may be required to assess the patient's condition before administration. How it works. It contains iron, 3-hydroxide complex with carboxymaltose, which releases iron to facilitate hemoglobin synthesis and boost red blood cell production. Directions for use. Administered only by a healthcare professional, Diron 500 injection is delivered intravenously either as an injection or infusion. The correct dose and duration depend on the patient's age, body weight, and the severity of their condition, which will be assessed by the physician. Possible side effects. Common side effects include headache, dizziness, flushing, high blood pressure, nausea, and site reactions. Serious side effects require immediate medical consultation. Precautions and warnings. Patients should use caution if pregnant, breastfeeding, or have underlying health conditions such as chronic kidney disease or liver problems. It is contraindicated for those with known allergies to ferric carboxymaltose or other injectable iron products. FAQs. 1. What is the use of this injection? It is used to treat iron deficiency anemia. 2. How long does it take to see results? Improvement in hemoglobin levels may take weeks. 3. Are there any common side effects? Yes, including headache and nausea. 4. Can it be used during pregnancy? Only if clearly necessary and under medical guidance. 5. Is it safe for elderly patients? Yes, but use with caution under medical supervision. Thank you for watching. If you have any questions or suggestions, please leave them in the comments below. We appreciate your engagement.